Okay, welcome. This is the Kern Valley Healthcare District Board of Directors. It's Wednesday, September 1st, and we have called the public session to order. We met in closed session, and we'll ask Scott to give a report on that in a few minutes, but we need to approve our agenda. So board members, please take a quick look at the agenda, and I'll entertain a motion in a second.
I'll make a motion, we approve it as submitted.
Thank you, Gene. Oh, dang it, I always do this. I apologize. There are changes to the agenda that I need to announce. On page 3 of the agenda, under medical reappointments, we need to remove the medical reappointment for Dr. Finstead, Dr. Gross, and Dr. Mongar. There's some T's that haven't been crossed and I's that haven't been dotted, and so we need to remove those from the consent agenda, and they'll be considered at a future meeting. And the same on page 2, under medical appointment for Mallory Swan. Again, there's some details that haven't been satisfied yet, so we need to remove Mallory Swan from the consent agenda along with the other 3 physicians. And now, Gene, if you want to make that motion again.
Okay, make the motion with the changes you just mentioned. And they're going to continue to work though, right? I mean,
Oh
they're
yeah.
going to wait till they, okay. Okay, yeah.
I'll second.
Thank you, John is second. And because we're back on Zoom and not in the room, we need to do a voice vote. So Catherine, your vote?
Yes.
Your vote?
Yes.
Gene, your vote?
Yes.
John, your vote?
Yes.
And yeah. So the agenda approved with the modifications I announced. And then we'll go to our flag salute, and Fred Clark is going to lead us in our flag salute.
Everyone, please stand. Place your right hand over your heart and pledge with me. I pledge allegiance to the flag of the United States of America, to the republic and one nation under God, indivisible, liberty and justice. Thank you.
Thank you, Fred. And Mark Gordon will lead us in an invocation for this evening.
Heavenly Father, we're just so grateful that you are there to hear us and to support us in our efforts to provide meaningful and lasting and compassionate care to this community. We ask that you be with all those fighting this horrible pandemic at this time. We also ask that you be with the board of directors and the decision-making for the betterment of the hospital and the community. We ask these things in Jesus' name. Amen.
Amen.
Thank you. Our mission statement is listed on the agenda. Take a quick look at, and we'll move on to item D, which is public comment. So this portion of the meeting is reserved for persons who want to address this board on items that are under our jurisdiction, but not on tonight's agenda. Do we have any member of the public that would like to address the board? Okay, seeing none, then we will move on to item E, closed session report, and I'll turn it over to our counsel, Scott.
Thank you. Good evening. In closed session, Chief of Staff Finstead presented the medical quality report. No other items were discussed and no action was taken.
Thank you. Okay, item F is the consent agenda. And these items listed on the consent agenda, other than the ones that I'd removed earlier, will be considered and approved in addition, unless a member of the board or a member of the public would like an item removed and discussed individually. Does anyone request that an item be removed from the consent?
No.
Okay. Catherine, was that a no?
That was a no.
Thank you. Okay. All right, then seeing none, then I'll consider a motion for approval of the consent agenda.
Oh,
So moved, Rob.
Okay, I saw Fred. I'll put that as a motion.
Okay, I'll second.
Is that John? Okay, John seconds.
You can see him faster than he can hear you.
So, okay, Catherine, your vote.
Yes.
Fred, your vote.
Yes.
Jean, your vote.
Yes,
John,
Yes.
and I'm a yes. Our consent agenda is now approved. Which brings us to item G, the reports. And we have foundation report. I see Debbie on the line. Are you giving the report tonight?
I am. Can you hear me?
I can only see half your face though.
I know it's the way the camera is. If I move it, it'll see the ceiling.
Okay.
So we are moving forward with the health fair. And we have what are you laughing at?
Don't
Nothing.
understand that, but that's okay. Just like,
And Ashton will be up here for a blood drive. So hopefully we get a good reception of that. And if so, then they'll look forward to partnering with us in the future. The blood drive is going to start at 9 o'clock. The health fair actually starts at 9:30 until 12, and the blood drive will be over at 1 o'clock. We have also decided, rather than to do the blood draw for cholesterol, we are going to actually do free COVID testing at the health fair this year. So we're getting ready to send that information out. The Crab Fest is moving along. We're getting some really nice items for the silent auction. So if any of you still need tickets, you can see me. You can go to Alta One and see Colleen Bugarelli. You can see Carrie Bunting at her office in Isabella, as well as Kat, who's at American Job Corps, and they're located in the Vaughn Shopping. So hopefully everything's coming together. Any questions?
Anybody have questions for Debbie?
Nope.
Thank you.
Debbie, I do have a question. This is Ross. Is this going to be outdoors?
Yes, both events are outdoors. We are limiting the tickets for the Crab Fest, and we will be able to, our plan is to social distance the tables. Typically, people will sit together at tables that they've already been close to anyway. We'll have hand sanitizer out there, bottled water,
masks.
trying to figure out the best way we can do it and stay within safety measures.
What about masks? Are we going to require masks to attend?
It's hard to eat crab with a mask on.
Yeah, it is.
Sure is.
I mean, if we follow what
Keep them
the
outside, that's the thing.
county is doing right now, we don't need to wear masks if we social distance, and the group would be less than 150.
Okay,
That could change. That's the rules today.
all right. Do you anticipate the rules changing dramatically after the recall election?
I have no idea.
There are plenty of rumors.
I'm wondering. Okay. All right, Debbie, thank you for that report. Appreciate it.
Thank you.
Okay, Cindy, our auxiliary report.
Thank you very much. I don't really have a lot to report tonight, other than we got the approval this morning through email that we're taking our meetings back to the senior center. And they will be, the same time as usual. And the thrift store is doing great, still 3 days a week. Gift shop's doing great. That's about all I have to say. It's good.
Cindy, thank you.
Thank you.
Be sure you pass on your the board's thanks for all that our volunteers are doing. You guys do an awesome job, and thanks for getting things moving again.
I shall do that.
Okay, Dr. Finstead, our medical staff report.
All right, thank you. So in July, the medical staff meetings were by and large dark. Last month in August, we were back to our regular meeting schedule. It started off with the nursing center, a continuous quality improvement meeting on August 4th. They reviewed their regular reports on monitoring how things are going in the SNF. So including the plan of correction compliance, hospital-acquired infections, hand hygiene, infection control assessments, along with the regular medication regimen review, which is where they review particularly the psychotropic medications to see if they can have a dosage decrease, and if other medications are continue to be appropriate. That's done, that's initiated by a pharmacist. They also reviewed, after that meeting, they had their antibiotic stewardship part of the meeting and things and stuff. And so they reviewed antibiotic usage for urinary tract infections, skin infections, respiratory infections. And then the Pharmacy and Therapeutics Committee met on August 9th. We discussed some COVID-19 related issues. We also reviewed and approved some additions to the pharmacy. These were brought by our head pharmacist, CCON, regarding having some medications available in pre-mixed in IV bags. When it's a big issue when you add medications to IVs. That's become more and more of an issue in things. Things that has to be done under very specific conditions and stuff, and we don't have the space that the state would like us to do. Anyway, so doing this simplifies things, makes it easier and less room for error. We also discussed the possibility of using a barcode scanner in the ED, like we're using on acute care. Things that's still up in the stratosphere and things. And then we reviewed our regular monthly and quarterly reports, particularly blood usage, analysis of blood culture results, medication error reduction program, Foley catheter usage, MRSA surveillance, and hand hygiene. Then the Medical Quality Council met on August 17th and reviewed the data that we presented in the closed session. Infection Control Committee met yesterday, August 31st, and reviewed their reports regarding employee exposures, the hospital-acquired infections for both skilled and acute, blood culture analysis, antibiotic usage, among other things. And then the Medical Executive Committee met last night. We reviewed the credential files that you approved. So those are basically in two categories. They're part of the radiology, the teleradiologists. And then as kind of a subgroup from that, there are two cardiologists that are on staff for interpreting the echocardiograms. So Marie Quick in Medical Staff Services deserves a huge round of applause. This is a lot of work to put these together, gathering the information, checking data banks, getting things organized, having us review them. So this many in one meeting is a lot. We also reviewed, reappointed Dr. Liu, our pathologist, to active staff. Then we reviewed the privilege request form for nurse practitioners. We made some changes in that to make it more up to date. And that was the reason why that Mallory Spawn was not, we did not approve that, because we made this change, and she'll come up for our next meeting for approval with the new privilege request form that is more appropriate. We also reviewed policies regarding basic clinical pharmacy. We reviewed the reports on procedural sedation that done by our nurse anesthetist, Travis. There are some issues there that we're going to be delving into in this month's Pharmacy and Therapeutics Committee. This is always an issue that is fraught with potential issues and stuff. And there definitely are some issues and things that we will try and dig down and figure out how best to deal with those. We also discussed revision of medical staff bylaws. We looked at some mortality and coroner's reports, and brought reviewed a the chaperone policy for the hospital, made some changes, and we'll be bringing that back for review before approving that. And then we reviewed some regular reports from the state on things regarding medical and osteopathic providers. And that's the end of my report, unless there are any questions.
Board members, do you have questions? Okay, I do. Dr. Finstead, you'd referenced the barcode scanning of meds in the ER, and that's up in the stratosphere. I'm not
Mark can talk to that. I mean, it's there's some logistical issues there that he can better describe than I can.
Are these obstacles, are they going to go away when we get a new ER, or is it some internal process that we're dealing with?
Frankly, these are internal processes, and basically what the problem is when you work in an emergency room setting, a lot of the orders that you get are not written immediately when it's so quick that it's happening very quickly.
Sure.
One of the things that barcode scanning requires is that an order be written before you can scan the medication. So it doesn't give us any benefit. We have to work on the fly. So we literally are charting after we've given the medication. So it's kind of, I love the idea of the barcode scanning. I just don't see how we could make it work right now in this time. So that's
it's used elsewhere in the hospital, just the ERs. It's kind of impractical.
Sure, absolutely. Understand that's the nature of the beast of the services provided there. What are they doing in other hospitals? Is our best practice that we need to emulate?
Well, those are things that I have to work out and I have to investigate. I know that the concept, and I watched the video that T-System put together for their barcode scanning, and in concept, it doesn't add any steps to what the nurse is already having to do. It's the timing of how the order is placed. If the doctor's placing a verbal order, the order is not there and to say this is the correct med at the correct time on the correct person, because it has nothing to compare to. So we have to really change our practice with how we're ordering those medications before we can even implement something like that.
Interesting. Okay, that's quite a dilemma. I'm sure you'll figure out a solution though.
I will.
Without slowing down service to our patients. So that's great.
Not to mention the outlay of cost is pretty substantial. It's a $25,000 initial investment, along with $1,200 or $1,300 a month just for the coverage of that. So we're weighing these things, and I know that the pharmacists are they're very excited about wanting to do this, albeit we need to change some of the things, the way we're practicing things back there right now. And maybe if we have a better organized ER, that might happen.
Yeah, one potential solution would be to have another person, to have a scribe for the emergency room doctor, so that the doctor would give the order, the scribe would enter it, and things, and then if there would be an order to compare it to. But still, that's time, and things. And it may work in some situations where they aren't quite as urgent, but
right.
It's a complicated process,
Yes.
And time is obviously the big factor.
With the voice technology now on your iPhones, you can pretty much dictate anything into it, and it becomes a text. I wonder if there's a technology like that could speed things up.
We use voice we use voice dictation systems back there now that actually feed right into the EHR system. They just haven't worked out yet for the medication side. It's probably coming,
Okay.
but like I say, not that we in the systems we're using.
All right, guys. Thank you. Dr. Vincent, thank you for that report.
My pleasure.
Okay, so we will move on to item 4, Chief Executive Officer report. I'll turn it over to Mr. Magoo.
Hopefully we got lots of time here. I'm just kidding. First off, I'd like to start by introducing Dave Recupero. Dave is our new interim Chief Financial Officer. Really appreciate Dave agreeing to step in and help cover while Chet's out. He's been doing a bang-up job so far and is identifying a lot of things. And so working very hard with Barbara, and I appreciate all Barbara's help in getting Dave up to speed. And so, they will, go over some of the financials later, but just wanted to introduce him. Dave, if you want to say anything.
Hey, everybody. Thank you. Thank you, Tim. I'm happy to be on board. And I think tomorrow's my 2-week anniversary. And my thoughts and prayers are with Chet and a speedy recovery.
Absolutely.
Thank you and welcome.
So with that, kind of just jump in on COVID. And I'm not going to go into a lot. There's been a lot happening here, as I think I sent to each of you an email the other day. And I'll let Mark go into the details on that, but has been a lot of other things going on. Obviously, COVID in the community has been going up dramatically. I just got off my conference call with the county CEOs. And, like I said, last week, we saw a little bit of a plateauing of some of the numbers. So they were thinking at one point that it may not go as high as they were predicting. But the big issues appear like this week that's kind of taken off again, where we're seeing like 400 to 500 new positive cases a day down there. The hospitals are full. I know, was it Mercy Southwest is running probably about 20 patients over their licensed bed capacity, mostly COVID. I think they're probably 80% COVID patients in there right now. Just huge. And it seems like it's starting in that southwest corner of the valley and kind of moving down towards downtown and this way. And again, just because a lot of lower income people down in that area per se, and who aren't vaccinated. And that's really what they're seeing. Probably 95 to 98% of the patients that are positive there have been unvaccinated. One of the issues that we're having, with a lot of this is obviously, we've been having difficulties, obviously, getting patients transferred out of here at times, although it's picked up from time to time. The big issue, as we talked about tonight, is not the number of beds that we have. It's the fact that our staffing is off. Ken Keller was sharing from Memorial Hospital, they are off by 24% on their staffing. They don't have enough nurses. I raised the question with everybody is how much of this is due to the staffing mandates that were put in, and everybody said it's a big piece of it. They're having staff who are just flat out refusing to get that done. They're being laid off, those that are not willing to apply for waivers. And so that's created a huge issue.
Tim, could you clarify that? You said staffing mandates?
This vaccine mandates.
Vaccine man. Okay, I was
Yeah.
just curious.
Yeah, well, I got staffing stuff coming up too. Yeah, like I said, it's just, one of the things that we found out that the state apparently has nobody left on there. They contracted with certain agencies to provide staff for the state, which they can then allocate back out and charge the hospitals for. As Mark learned today, the state has nobody left. We called. And so what we were advised to do is to make sure that we call everyone on that list of vendors that the state had contract with to verify that they have nobody. If we then have done that and they don't have people, then Bryn Kerrigan wants to know, she has some other things that she might be able to make happen through the county. So that we just learned tonight.
Hey, Tim,
Yeah.
in that regard, then, is the state talking about waiving nurse to patient ratios or allowing?
No, they're not yet. They haven't. They've been real reticent about doing that, although that may come. Like I said, a couple things going on. Right now, I raised the issue with Vince Fong, who was on the call with us tonight, about the fact that, what possibly could be done about moving that date or removing that date for the mandate vaccinations to take place, because right now we have to have everybody vaccinated or on a waiver by September 30th. And I just said, this thing is supposed to peak within that first week of October. And this is a heck of a time for us to be having our staff forced out because of their desires not to be forced to be tested or whatever their convictions are. He has been gravely concerned about that. He is going to have a conference call with CDPH administration tomorrow and get back to us to let us know. He says, because he's hearing that, because again, he's really covers a pretty wide area geographically. He's hearing that as well. Fresno is at a point right now where they are anticipating by the end of the week that they are going to be moving into crisis care mode, which is about as severe as it gets in terms of their care. I mean, patients will be transferring out of the county altogether. And so there are several other areas that are expected that they will probably also convert over to crisis care. We were all advised to review our crisis care plans, obviously, if we don't have the staff. So that's something that we're going to be working on. And as I said, again, it's literally most of the hospitals are off dramatically on their staffing that they have. Again, just all kinds of reasons. People have left the area. People have retired. They've used COVID as a reason for just saying, I'm done. We've had people that, again, some that have decided to go in to do the, registry work and stuff like this. And, because right now this is affecting a huge swath of the country right now. Fred, do you have a question or? Oh, so there you go. Anyway, so this is just becoming a huge, huge issue. So we'll see whether or not Vince might have some effect with CDPH. I'm not counting on it. Like I said, it's just it's got everybody worried at this point in time. Let me think here. One of the other things that we are doing is there's some discussion about the booster shots and so forth. The state announced today that they are not considering third boosters for everybody because there's not enough evidence yet to support it. Again, I think that the general consensus was that the feds were too early in announcing that move. And so the state has decided they are not going to push for that. It was basically felt that it will probably happen at some point. Apparently Israel, I guess today, announced that they are changing their COVID passports to only to expire 60 days after their second vaccination, which basically will then force them to get another dose, a third dose after that. So, and they're expected that that's going to probably be considered a pretty viable option for a number of countries and so forth, and that the US may in fact follow behind something like that type of a model. So we'll have to wait and see. Anyway, that's, as you can see, there's been a lot going on, and Mark will get into more of the detail of what we've been doing. It's consumed a considerable part of our time. Pleased to report security has started. That is going well. We've actually had staff that have shared that they've been very appreciative of the fact that they're having dedicated coverage at night and on weekends, which is exactly what we're hoping. I'm pleased to report we finally have the rent payments coming through from our tenant down in the new building. Their plan is at this point to be out of the building by November 13th for good. And so we will continue with that. I basically kind of threatened them if they didn't want to be out here on the 5th of November, that I'd better have a red check today, and they delivered this morning. So
I think you mean September.
what's that?
I think you mean September,
What did I say?
November.
September, excuse me, September 13th, they're supposed to be out. So anyway, that's hopefully coming to a close here very shortly. We have got the as-built drawings done on the new building. That has been completed. And so they're now, Bob's kind of ready to move forward with getting the bids for the architectural work and the engineering on that in order to get through the county requirements. Because this does not is not an OSHPD project, it's county of Kern that we have to get through. And then last thing I have, again, working, again, as I announced before, our GI physicians have decided that they're not going to be coming up from Bakersfield anymore. That was a really abrupt thing. We had no advance notice that that was going on. I am in the process right now of identifying coverage either through a locums agreement at some point while we continue to search for somebody on a full-time basis, or we may just decide that we may be able to find it since we're only doing it a couple of days a month, that we can cover it adequately with locums. So I'll keep you apprised of what's going on with that. Right now, we kind of can't do it because we've got some key staff in there who are away from the facility for a little while. So again, that will preclude us from starting that back up shortly. But we hope to have that going here for too long. And then I think that's the last thing, just from an advocacy perspective, is we've been asked to work very closely with our federal legislators to try and push for an extension on the deadlines for spending the provider relief funds payments. The original deadline was June 30th. So in other words, we all got monies from the federal government that we had to use for COVID. That money had to be spent by June 30th. If it wasn't, then you had to pay it back. There are a significant number of legislators, I think it was over 40 in the Senate, I think alone, that pushed through a letter trying to extend that deadline to either December 31st of this year, or as long as the emergency order or emergency effort was in place, which could take it considerably longer considering the pandemic and the situation that's going on right now. So this is going to be coming up very shortly. So I'll be on the phone tomorrow, making my phone calls to see if we can't add some support to that effort. So, and again, I know Dave is working on some of that stuff right now, and he can probably talk about it later, and Barbara's also. And that's my report, unless there's any questions.
Any questions for Tim?
All I have to say is, Tim, hang in there with everything going on. I know it's overwhelming, as it has been all year, but you're doing a fantastic job.
Everybody, it's a team effort. It truly is. And it's,
Yes,
like I said, I think everybody is, this is well over a year and a half now that everybody's been going through this, and it's tiring, it's stressful. We get on each other at times and stuff like this. And, again, I think what brings us back is the fact that, again, we remember that we're doing this for the patients. And so, we have to have that moment to kind of let off some steam and just try to regroup and stuff like that. And I think the team is doing a really pretty good job of doing that. So I'm pretty proud of everybody.
Thank you.
Great. Thank you.
You're welcome.
Okay. Good report, Tim. Thank you.
Welcome.
Okay, that brings us to our Chief Nursing Officer, Mr. Gordon.
Well, good evening, folks. I just have a few things to report regarding COVID. We know that there's a resurgence and an increase in the cases in the community. We're with every positive case that we see, we probably see 10 more through the community testing site on every Wednesday. This week they saw 67 through that community testing, which is almost double what they saw last week. Last week they had 7 positives out of 36 or so.
37, yeah.
You know, it's compounded by, oh, I had an exposure, I got to go see the doctor, I got to go get a test. So you know, the other thing is, if a kid shows up at school with a runny nose, the leadership at school automatically tells them they can't come back until they have a negative COVID test. So they got to go get tested. So anyway, the unfortunate thing is, with the increase in the community, also exposures to our staff increase. We did have 3 positive staff members from the facility who are out with COVID right now, and 1 significant exposure who is off right now with just the exposure. So she has to be out for a period of time. The skilled nursing center also fell victim to 6 positive cases from that as a result of that. So we are under full yellow zone restriction status with a partial red zone for the positive cases. The other thing that bears is the fact that we have to have exclusive staff for the red zone treatment and therapy. And it's very difficult to provide that. Those staff members can't work in the other section of the skilled nursing facility. So I did reach out to the MOAC, which is the service that from the state that was going to provide nurses, and they encouraged us to reach out to the certain agencies that are providing nursing staff. Tina was able to secure 2 LVNs through that, not the MOAC, but just one of the registries happened to have a couple of LVNs that'll be available next week for us. We're going to use them in that red zone environment so that we can meet that need. Most of the residents that are diagnosed with COVID are either asymptomatic or mildly symptomatic. They're all vaccinated except for 1 resident over there. And I think 48% at the time, 48% of the skilled nursing center staff were vaccinated. One of the positive cases was fully vaccinated back in January of last year, or January, and the other 2 that I mentioned were partially vaccinated just recently. So we're seeing a lot of positive cases that are vaccinated. That's why it's so important to lead me to my next subject, and that is the new efforts to ensure mask compliance in the facility. For that little bit of downtime that we saw from the last COVID resurgence to this one, we kind of, I think, got a little lackadaisical about allowing mask or enforcing the mask rules and things like that. Well, you're seeing new efforts by myself and all of the leadership team going up and down the hallway to, if you see somebody without a mask, you need to make sure that that mask is on. And so we're really focusing, I think, with Greg and myself and Tim, and even Heidi's out there cheerleading the mask wearing. So we need to understand and realize that this is real. It's in our facility. It's we're being exposed to it in the ER. We're being exposed to it in the pre-screening areas. So we're just making sure that everybody is following the mask guidelines. I think the mask might have as much effectiveness at preventing COVID as anything that we are doing right now. So we have also gone back to a single point of entry, enacted with a new position being proposed. I think I looked at a job description today from that'll be presented at the next board P&P, which includes a receptionist position, so that we can have someone seated at a desk checking people in that are coming in to either visit. While visitation is severely limited, we're offering visitation by appointment only, and then they have to be vaccinated or show a negative test within 72 hours of their visit, or they don't get entry. The other thing we are offering is a tablet to do FaceTime visits with loved ones and things. So there are things in place that we have that we're trying to mitigate some of that distress that visitors feel when they can't visit their loved ones. So we're trying to meet every need that we have while still protecting staff and patients and the residents. Let's see. Hey, the transport van is on its way. However, I did hear it was leaving from Tennessee, and I heard the wind was blowing a little recently near there, so that may have slowed down with the hurricane and the rains that they had. So I don't know where that. I contacted Aaron, the contact for that shipment on Friday. He has not gotten back to me with the actual delivery date, but he said he will send me a tracking mechanism to be able to know where that thing is. The other thing is, you'll see later on in your packet, there's a CER for the Subaru. I think it was approved on the consent agenda. We, as soon as we have a check request filled out and Barbara signs that, we will be able to go pick that up. That is in Bakersfield, that's Sangera Buick, or a Sangera Subaru. Shannon also has interviewed and hired one individual as a driver so far. We're excited. The other thing is, I've spoken with CDPH regarding our incident, and it seems like they are very supportive and very happy with the way we reacted and responded to the cases next door. So more to follow. But if there are no questions, that's my report.
Mark, I have a question. The person that's going to be the receptionist, is she going to be screening too? I mean, are you going
Yes.
to be taking, okay.
That is a pre-screening position. It's actually being filled right now as we speak by a per diem employee who was a housekeeper. She is also sitting across the table from you. And I would love to just thank her. Cindy has been very diligent about sitting there pre-screening individuals when they come through the pre-screening when she comes through the anybody checks in for lab work, for x-rays, for ER visits, just any kind of outpatient service. She's the one doing most of that pre-screening.
Okay, thank you.
I eased up her workload today, though.
Mark, thank you for that report. Do we have other questions?
No.
Jean, were you going to comment?
No, actually, I hate to keep repeating myself, but eventually we could get to the point where the CNAs, according to Debbie's newsletter, they weren't required any training. They just assisted the nurses at their direction, which we could have to get back to. I guess when Reagan gave them training money, then it was required training. But I still think we should be looking for possible volunteer force or paid unlicensed if things get worse, both ways, with staffing and with more cases. So it seems like we should be preparing a little better as far as our options. But that's, I don't know.
We hire nurses aides that are not certified on the acute care side, and we train them. The laws for Title 22 do mandate that anybody who has patient contact on the skilled nursing facility is required to have a certified nursing assistant license.
Is there any circumstances, emergency, that most of the time you can sort of go around rules when there's an emergency? When we have problems, then we can't perform. Do we break the law, or what do we do?
Well, here's the problem with that. There are not a lot of people stepping forward to take care of patients. They just are not there.
Are we
I would
asking? Do we
definitely
know?
The
I
answer
would
is no, we
definitely
don't break the law.
Yeah, well, that's, yeah,
You know, the bottom line is, like I said, you know, we do the best we can and obviously working within that.
Okay, I'm not criticizing. I'm just
Yeah,
saying.
no, no, I get you.
We're doing awesome. I mean, you guys are doing wonderful. But I'm just saying, should we be investigating some what if scenarios to where it could get really bad quicker? And,
Yeah.
and
I can respond to that, Gene. Like I said, at this point in time, the state health department allowed the staffing waivers to expire. You know, if this continues on and we continue to see the trends that we're going to doing, it's very possible that they may reinstitute those that will allow us to bring nurses in and others from out of state who don't have California licensure. We were allowed to use students to help in SNF care and elsewhere, and as long as they were under a licensed nurse and things like that. That may return at some point, but not at the current moment.
okay, all right, thanks, Tim
You bet.
and Mark.
Any other board member questions for Mark? Okay, then we'll move to item 6, which is the Chief Financial Officer report. And I again want
I'm
to
gonna,
welcome
hi,
Dave.
everybody. Thank you. I'm going to turn the beginning part of our presentation over to Barbara, and then I'll just kind of add a few more tidbits after she's done talking.
Thank you. Hi, Barbara.
Hello. We're reporting on the month of July, the first month in the new fiscal year. The statistics are on page 11, and the acute care had an average daily census of 5.4, which is good for them. The average census in the SNF was 49 for the month, and the emergency room had 663 visits, which exceeded their budget and exceeded the prior year, same month, by over 100 visits. And the outpatients were 1,040 for the month, and the clinic primary care were 1,155 and 327 specialty visits. With these volumes, if you go to page 14 is our revenue and our expenses for the month. Our revenue was quite high, $10,805,000. We just ran the revenue for this month and it's 10,000,004, I believe. So it's up there too. After our deductions, we had a net operating revenue or a total operating revenue of $3,189,000. And then we had expenses of $2,575,000, which gave us a operating surplus of $613,000. After we added our non-operating revenue and expenses, we ended up with $642,000 profit for the month of July. And as the first month, it's the same on the year to date. Does anybody have any questions about anything?
Barbara, on 13, I don't know if Dave maybe can answer it or if it would be you. Under the long-term liabilities, the HHS Medicare Advance, it's showing as a long-term liability. How are we paying that? Are we going to pay for it monthly?
We don't know.
Long-term liability.
I'll address that, Barbara.
Okay.
It's a good question. We try to be conservative and show the potential for a payback until we know for sure that we don't have to pay it back. So Chet has been careful to make sure that we didn't prematurely show that as money coming in as that we can keep until we complete the audit process that Barbara and I are buried in right now. We've spent tens, if not hundreds of hours in really trying to put our best foot forward to complete the documentation that the auditors will be looking at that will hopefully allow us to keep most of that money. But until that point, it's going to stay on the books as a liability. Does that help?
Okay, yes, and now we have been flooded with money from IGT and different money, and it just gets deposited in our account. And from what I hear at some of the meetings, we don't even know why it's there. It's just there. And so
The nice part about all that is it does show up favorably on the balance sheet in terms of higher cash balances, but we're being careful not to show it on the bottom line until we have more legal wherewithal to make sure that we don't have to pay it back. So you're right, there's been a lot that has come in over the last year or so that has really helped us a lot in terms of extra cash. And I believe a big part of it after the next few months, we'll start being able to post that as onto the revenue side of our P&L.
okay, so we're addressing it because it was looking like it was. eh,
So far, I haven't.
Thank you
So
very
far, I
much.
haven't seen anything that alarms me. That if we do a good job, we should be able to keep most of it.
Well, if you haven't seen anything that alarms you, you haven't seen a picture of me yet.
I try to keep a positive attitude. It surprised me actually because this hospital, compared to other hospitals I've been working with, you guys haven't been affected as much on the revenue side. Now, granted, the expenses are a lot higher with all the COVID preparation, but on the revenue side, I've seen hospitals that have dramatic 30-40% drops during this COVID period, and thankfully KVHD has not had those drops, but nevertheless, I think we've got enough documentation, hopefully, to keep most of that money.
Cool. Okay. You're doing exactly what I was hoping you are. So thank you very much.
Gene, this is the reason, like I say, in finance committee that I asked Dave to begin focusing a lot more on the balance sheet when we meet, just for that very reason, so that we can kind of get a better understanding of what's out there. We have focused really for the last, 12 years or more, primarily on the P&L and so forth. But I think, again, considering our cash situation and this money's in and out, we probably need a better, we all need a better comfort level with what's going on.
Well, it sounds like we're getting there, Tim. Thank you very much.
You're welcome.
So the only thing I was going to add to Barbara's report is just as a summary, it's not surprising that we had such a good month. If you look at the fact that revenues were up 17% and expenses are actually down 4.8%. So that's a good combination, beating budget by 581,000. The one other interesting part that we didn't mention in finance, when I went and drilled down and analyzed why outpatient revenues were so high, if you go on page 14, you'll see the fourth line down from the top under gross patient revenue, a 583,502 favorable variance in outpatient revenue. And I was thinking, well, it was obviously a busy month of ED. And I looked at the detail, and it might have been ED patients, but the departments that posted these big variances came from laboratory with all the testing that happens when they show up in the ED. And then the CT scanner actually had even a larger favorable variance, and pharmaceuticals. So that actually makes sense of what's going on to have those three departments generating a much higher revenues on the outpatient side. And then one other thing that, go ahead.
But the clinic is still doing awesome, right?
Yeah, and the clinic was also positive. It wasn't quite, it didn't make the top 3 or 4, but it also was favorable. So that was very positive as well. On the expense side, you see insurance expense being higher. I believe that's a function of how we get billed on beta insurance. For the malpractice, they typically front load the annual amounts the first couple months, and the way we budget it is we spread it evenly across the year. So I think that will even out over the year. on the insurance number, which was 27,000 over budget. The other line item that we were over budget, all other expenses, was 41,000 over. Infection control, which has to do with the COVID related additional costs for miscellaneous items, that was significantly over. And auxiliary had some higher expenses along with clinic and ER. So that's what caused the all other to be higher. So I don't see anything on here that that looks too far out of order, especially considering it was such a busy month.
Yeah. Yeah, it's Barbara's doing a good job.
Yes, and I do want to especially say some things about Barbara, because I'm just so impressed with how by herself she has handled 2 or 3 people's workload, and she doesn't complain, and she's very proficient at it, and we're lucky to have her.
And she's put up with me on top of
that. And I said the same thing to her, because I kind of already been pushy with her the first 2 weeks I've been here. So she puts up with us, and you can see the dedication she has.
Cool.
Thanks, Barbara. Okay, is there Dave or Barbara, are there things that you wanted to report on?
No, unless there's not any other questions.
I had a question on page 18.
On which page?
18.
Okay.
Our financial strength index isn't only positive, it's off the charts. I've never seen this.
And I think some of that is skewed because we're at the beginning of the fiscal year, and it kind of it exaggerates the picture. But you're right. I think the combination of a good cash position and good bottom line operating margin causes that strength index to go way up. Yeah, we should feel really, considering everything else going on, that this organization has been well taken care of.
Great. Thank you, Dave. Thanks. And
yeah, Ross, this is John.
Go, John.
Yeah, that's actually the comment that I was going to make. That's the first time that I've ever seen the financial ratio over a 4.0. But even on years where we were just starting our fiscal year, Dave, and I'm sure Barbara probably filled you in on it, for the last 30 years, we had actually had financial obligations with Cal Mortgage that we just finally got rid of just recently. So that has also freed up a lot of our cash flow month to month. But this is the first time that I've actually seen it over 4.0. So that's remarkable. Hopefully we can get it between a 3.0 and 4.0 here moving forward. That would be fantastic.
Yeah, I was going to comment on that financial strength index also, but I thought they just ran out of red ink.
So on the negative side, I did notice one typo. If you guys want to fix it, page 9 of the Finance Committee minutes. If you go back to the page 9 of the packet, you'll see well, 2/3 of the way down, the total surplus, total net surplus is 642. It says /loss, and then it says the word loss after, and that should be gain. So
that's a big one.
The positive bottom line for the month was 642. It was not a loss. So.
I will correct that.
Thank you.
Well, thank you, Dave. Barbara, thank you for your continued efforts. And Dave, it already sounds like you're a great addition to our team, and thank you for being here with us.
Happy to be on board.
Okay, so we will move on to item H, old business, and there's none. So new business, and we have a capital expenditure request for gurneys. Mark?
Yes, sir. I forgot I was on mute. So the gurneys that we have, I actually closed my gurneys that we have. We had 2 gurneys fail recently And we placed we did the right thing by red tagging, isolating, reporting, and trying to get those fixed. Unfortunately, because of the numbers that we're seeing in the ER, one of the staff looked down the hallway and saw one of these gurneys because we needed a gurney. They brought it back into the ER to put a patient on it. Nothing bad happened except that when they took him out to the CT scanner, when they went to elevate the patient, only half of the bed came up. So the radiology tech was a little upset about that. So we actually told maintenance to get them out of the hallway, get them out of sight. And we have an emergent need. These gurneys have been in place for about 11 years. I think I bought them new when I started this job. They've been in good service for us for those 11 years. We are hard on these gurneys. The ER, they are built like tanks. I mean, they're constantly going out to the helipad over off-road capability. I mean, they're going out to the CT scanner up a ramp and over thresholds and things. They're just beaten up, and we do well to try to take care of them and keep them in working condition. I think maintenance does a really good job whenever we ask him to fix a break or something like that. But this time I got their take on these two that are in question, and their recommendation was to replace them. So what you see before you is the replacement cost of Stryker's quote and Hill-Rom. Hill-Rom we have experience with. They're the cheaper ones. They also have actually a mattress and a service contract. So I think that's a kind of a no-brainer. We need to buy these two as soon as possible. As soon as the auxiliary meet, I'm going to go to them and see if they're willing to purchase those two gurneys for us.
But Mark, could you go to the foundation, maybe split it again? Because that's something we do also for things just like that.
Whatever your wish is.
Well, just ask if you wouldn't mind.
We'll talk about that. We'll look at that wherever we can get it done fast.
Okay. I'll make a motion. We approve it and try to get reimbursed through the auxiliary. For that, we need to purchase. So I make a motion. We purchase them.
Okay,
I'll
Denise, have the motion.
I'll second that, Ross.
Fred, any
Yes, sir.
discussion among members of the board on this item? Anybody else wishing to be heard? Okay, then we'll go to a vote. Catherine, your vote?
Yes.
Fred, your vote?
Yes.
Jean, your vote?
Yes.
John, your vote? There you are.
Yes.
And I'm a yes. So go buy them if we can get help with the purchase, great. But obviously we need these, Mark. Thanks for your work on getting this done.
Thank you.
Okay, so I'll turn over to our directors now for comments that are not appearing on the agenda, and we will start with John.
Okay. Yeah, I just want to reiterate what I've said in prior meetings. Just want to commend Tim and the administrative team, and of course the entire staff at the hospital for all the work they've been doing in these unbelievably trying times. Like Tim said, it's a year and a half into this, and hopefully we're going to see a light at the end of the tunnel here one of these days, but hopefully sooner than later. But again, just want to, just again want to commend everybody for all their hard work, and once again welcome Dave on board and all the work he is doing while Chet is out and helping Barbara with this. And Barbara's always been phenomenal, but I know she was kind of drowning there for a little bit, I'm sure. So I'm sure she's great to have the assistance there, Dave. And it's also nice to see another fellow UCLA alumni. Go Bruins. That's all I have.
Thank you, John. Okay, Jean, your comments for tonight?
everything seems to be working wonderful. You guys, every one of you are performing better than it's just, you couldn't ask for better. Times could be better and we could have more to work with, but you're all doing awesome. Thank you.
Thanks, Gene. Fred? You
To be
may
honest, I
be-
don't know where to start. Barbara, you always go above and beyond, and with Dave at your side now, I'm hoping that that makes things a little bit easier for you. Dave, thank you for joining the team. We clearly needed the assistance. And just having a fresh voice explain the numbers is a nice thing to have right now. Tim, Mark, Miss Heidi, as always, you guys always lead the pack. So just keep doing what you're doing. It makes us all look good. Beyond that, have a great evening, everybody. Thank you.
Thanks, Fred. Catherine?
I don't have any comments.
That's okay. You don't have to.
Good, because once I start. So I'm good, thanks.
Thanks, Catherine. I'll just keep my comments brief tonight. I just also want to thank everybody who, been a rough couple of weeks. We've got this resurgence in COVID and this Delta variant, the fire, the community's certainly suffered through that with evacuations and smoke. But the hospital keeps on going. You do it every day, every minute of every hour. And it's amazing to see the work that's being accomplished there by professionals. So please keep up the great work. Our community needs you, and we thank you for your service. So with that, we stand adjourned. We will meet again in 1 month. Thank you, everybody.
Thank you.
Thank you all. Appreciate it.
Thank you.
Good
Night,
evening.
everyone.
Good night, everyone.
Good night.
Right.